Welcome to Hello Doctor Talks. Today we are going to discuss about varicose veins. To discuss more on this, today with us Dr. Balaji Patel Kola. Dr. Balaji Patel Kola, Senior Interventional Radiologist, Vice President for Interventional Radiology Society for India, Director in Maven Medical Center, Hyderabad. Doctor, what is varicose veins?
Varicose veins have been very common. Now we have been hearing varicose veins very often. So a lot of population, like if you count in India, 30% of Indian population is suffering from varicose veins. So it is so common that even young patients, previously we used to think that, varicose veins are seen only in old patients. But now 25 years patient is also suffering from varicose veins. So varicose veins are nothing but the veins which are increased in sizes and which are bluish green appearing on the skin. So which are dilated, like they contain the impure blood and they appear as bluish green veins.
Doctor, what is the difference between spider vein and varicose veins?
Yeah, so varicose veins has multiple stages. In the early stages, the varicose veins, when they are less than 2 mm in dilatation, it is called as spider veins or reticular veins. But in the stage 2, when they grow bigger size, more than 2 mm, then they become varicose veins.
Doctor, what are the symptoms of varicose veins?
So varicose veins are considered as a dermatological problem or a cosmetic problem. They don't know that varicose veins is a disease. They think that they are sprouted veins which are dilated on the skin and they are not causing any symptoms. That is the reason that most of the patients don't get them treated in the early stages. So as the stage goes, the severity of the disease increase and the signs and symptoms keep increasing. So in the early stage, where as we discussed, like in spider veins or reticular veins, in that stage, or in the varicose veins, second stage varicose veins, which we see by the naked eye, these stages does not have any signs and symptoms. So people think that it doesn't have any signs and symptoms, so we can just leave it. But like any other disease, varicose veins also is a progressive disease where it keeps progressing to the multiple stages, the next stage, and then the signs and symptoms starts occurring. So in the third stage, where the varicose veins, the dilated veins will start exhibiting the signs and symptoms are like the skin changes. Initially, the skin will change into reddish purple color, and then even we see the swelling in the skin. And later, once the stage goes to the fourth stage, the skin becomes pigmented. That means that all the hemosiderin from these veins will be deposited on the skin and they become dark, like it will become black skin. So there we see only signs and symptoms. Still in this stage, people will not feel pain. And when they go progress into the fifth stage, where we see ulcers. So this is the stage where they start feeling pain and they start coming to the doctors. Even then, they know that this is a disease, this is abnormality on their legs. They will not consult a doctor until the pain comes. The pain will be coming in fifth stage. I advise all the patients, like whenever you see varicose veins on your skin, don't wait until the pain comes. Get treated, because it's an abnormality, it's a medical disease. And in the sixth stage, it has got non-healing venous ulcers. That means that whatever medication you use, these ulcers will not be able to heal. So it's better to treat any disease in early stages. Don't wait until the last stage of the disease.
Doctor, what are the treatment options available for varicose veins?
So many patients previously, if you go 10 years back, varicose veins was only treated by surgery. So many patients are afraid to undergo surgery. So they think that it's a simple disease. Why should I undergo surgery? But as the technology improves, as the medical things have come, new modalities have come. Now we have laser treatment, we have radio frequency ablation, we have microwave ablation, we also have super glue. That means that without surgery, without putting a knife on your skin, through small needle puncture, we can pass the laser or radio frequency or microwave, and this is all thermal ablation. So they pass through all these abnormal veins and then they ablate. That means that they destroy the abnormal veins and they come out. And these are all daycare treatments. What do you mean by daycare? You walk in, you get the treatment and you walk out on the same day. So you need not worry that you are undergoing a surgery. We don't call it a surgery because we are doing through a small needle puncture. We call it as a procedure. So please don't get afraid to get the varicose veins treated. So as soon as you see varicose veins on your legs, you have to come to the doctor and understand what are the treatment options, how easy is the procedure, get it treated and get varicose veins out of your legs.
Doctor, Did lifestyle changes will help in varicose veins?
It's a very good question. See, why we are seeing varicose veins in young patients? Because lot of young patients are doing their jobs and sitting on the table. They're not moving at all. They are glued to the TVs nowadays. They're not playing sports. So this lifestyle changes because of the obesity, because of the hormonal changes. All these have become very common, and these are causing the varicose veins. So if you change your lifestyle, you become more active, you decrease your weight, and that means, like, according to the BMI, according to height, you have to maintain the weight. If you don't do all these things, you will have varicose veins. So to prevent varicose veins, what I suggest is, first thing is, sitting is new smoking. So stop avoiding sitting for long time or standing for long time. So any person who has got jobs where you have to sit for long time, please get up within half an hour, walk for a while, and then come back and do your job. So do not sit or stand for more than half an hour. Do exercise every day, morning and evening if possible, and then maintain your weight. And while sleeping, put your legs above, above your heart level. A small pillow below your legs will start the blood flow back towards heart. So if you follow these precautions, you can avoid varicose veins in your future.
Can the treatment controlled with surgery or medicines?
Very good question again. See, many of the patients, though they see varicose veins on their legs, they go into the market, they bring some creams, they take some tablets, they go to some Ayurvedic. There is no medical line of treatment for varicose veins. Varicose veins are progressive and irreversible. What do you mean by progressive and irreversible? Progressive means it keeps on going from one stage to another. So no tablet can stop the progression of the disease. And irreversible, that means that once the vein is dilated, there is no medicine in the world which can get it back. When we know that it is irreversible and progressive, none of the medicine can work, you should opt for a procedure, like as I advised, laser or anything. You can do these procedures and get devoid of all these varicose veins.
Doctor, what are the precautions should be taken for varicose vein?
As I've already told, you have to take the precautions, like do not sit or stand for more than half an hour, no smoking, no alcohol, and that means it has to be done in moderation. Anything in more, it will affect all the blood vessels. And elevate your legs while sleeping, and then regular exercise, and maintain your weight. All these precautions will be very helpful in varicose veins.
Doctor, in the treatment of varicose veins, there are a lot of modalities. So which one is better?
Yeah. So science is always developing, medicine is always developing. So initially, 10 years back, varicose veins were treated only by surgery. And the patient used to have a lot of sutures on the skin, a lot of chances of infection. And patients were afraid of getting surgery done. But as the modalities have increased, like as the new modalities have come, we have introduced 12 years back laser. So endovenous laser ablation used to be done in 12 years back we have started. So later the technology increased and we have got endovenous radio frequency ablation. And now the latest one is endovenous microwave ablation. And in our center, we have all the modalities available. So what is the difference between laser, radio frequency, or microwave? In laser, we use around 800 degrees to ablate the vein. That means to burn the vein, we are using 800 degrees. The same effect is given in radio frequency ablation at 120 degrees. That means that you are using less amount of heat to do the same work. So, however, when you compare with laser and RF is always better. And the latest one is microwave ablation. So the same effect is given in 80 degrees. So you can compare, laser is giving 800 degrees, radio frequency is doing 120 degrees, and microwave is giving 80 degrees. It's very easy to understand that, at a lesser temperature, we are delivering the same results. So however, the superiority of radio frequency over laser or microwave over RF. So depending upon the patient's vein, like how much is the diameter, how much is, the rest of other perforators. So we choose the machine over here in our center. It is only one center in entire India which has got all the multiple modalities, where we don't force you, like, because you come here, I have only laser, so I'll not give you laser. But we have all other modalities. So we offer the modality according to the patient's vein diameter or any other conditions. So it is always better to ask the doctor that, do you have microwave? Do you have radio frequency? What is the modality which suits me more, rather than subjecting you to all to laser only or to another thing. And the latest one is super glue. Super glue means we are just delivering a small glue into the vein, and while coming we compress the vein so that the vein is closed. So we are not using any thermal ablation but a simple glue. So this has become much more simpler. So when you come to our clinic, these are all modalities which are available, and we give you all the options and we choose the best modality according to the patient.
So we have covered all the questions related varicose veins. If you have still doubts on this, kindly mention in the comment box.